Well, good evening, Dr. Grossman. How are you doing in Chicago?
Hey, Tony, how are you? Welcome to Howard Brown.
Very well, thank you. Before we move into viewer questions, what are your thoughts over this week's health news for our community?
Hold on, lost you for a
Can't
second.
hear him.
Can't hear him.
I see you. You can't hear me. Can you hear me now?
A little bit more. We are having technical difficulties, as we said at the top of the show. The show is live.
Yes. Whatever happens.
How is that?
I can hear him.
Is that
Much better.
is that any better?
Yes.
Okay. So the big news again this week is the Omicron variant, and the fact that it is spreading quite widely. And I know you have a question about that tonight. I think the news that we've heard. Certainly, I know a friend of mine just told me they had the first death from Omicron in the UK in the last couple of days. What we're hearing is that this virus is at least twice as infectious as Delta, but probably less threatening and making people less sick. So I think we will see breakthrough infections. We're certainly seeing a rise of infections across the country. I know here in Illinois, our numbers have gone up significantly, and I know in Florida that's true as well, even though the state tends to underreport it in Florida. And the state is, apparently this, according to the Palm Beach Post the other day, the state is tracking the variants, but not reporting it except to the lawyers from the various press organizations that are forcing them to report it.
Not surprising.
So, welcome to DeSantistan, as Joy Reid calls it.
Yeah.
So that I think that's been some of the big news. So the other news that I think we heard this week that's good in the last couple of days is that Pfizer has reported that people who've gotten the booster seem to be doing well in fighting this new variant. And again, 99% of the cases that are showing up at hospitals and new infections are Delta and not Omicron.
Thank you for that, Dr. Grossman. Let's jump right into tonight's questions.
Good evening, Dr. Grossman. What members of the LGBT community can do to help with their mental health over the holidays?
Well, I think the holidays are often a stressful time for everybody, not just LGBTQ people. But certainly, I think for many of us, we don't have traditional families necessarily. We don't have traditional families that we can depend on. We may be forced to go back into situations where we're in the closet or where we're with family members who don't accept us. I think one thing we can do on a personal level is remember that we don't pick our families. We pick our friends, we have our chosen family, but our families can push our buttons very easily. So I think when we hear our families say certain things, we need to stop and think, how would I feel if a stranger said that to me? I'd probably let it roll right off my back. And I think, but with our families, they can push those buttons all the time. And again, you don't choose them and you don't necessarily choose your feelings towards them. So many of us love our families despite their right-wing politics and their, maybe not understanding our gender identity or our sexuality. And you know what? We have to sometimes just let it go. We don't have to change them. That's the mistake we all make. So I think that makes family things better. And I think the other thing is that we need to support each other in this time. It's important if you have single friends who are on their own to reach out and try to draw people in. And people also need to take advantage of the resources that are available, whether it's places like SunServe or Compass in South Florida, or Howard Brown, or the Gay and Lesbian Center on Halsted here in Chicago. So many places have places that are welcoming to people during this season.
Thank you for that. Thank you, Dr. Grossman. I'm going to remember and have your voice in my head when I'm sitting around that table with my entire family wondering why I'm sitting there exactly. So thanks for that.
Remember, Tony, you don't have to turn them into people you would pick as friends. That's not who they are. They're your family.
Very good point. Thanks for that, Dr. Grossman.
There's a lot of really good advice there. Dr. Grossman, before I ask you my question, which is about the variant, I just have to say, nicely done with the floral bow tie.
Oh, thank you. Thank you very much. I try to wear a different one every day just to shake them up around here.
All right, so a Central Florida city found that Omicron in their sewer water. So it's been detected there, even with no confirmed cases in the area. So you touch upon this a little bit, but how widespread do you think this variant is?
I think at this point, I think we're realizing that it's quite widespread. So as of the 10th of December, it was reported in 23 states. It's expected that in the next 2 weeks, it will be reported in every state. So it's already here. It's already everywhere. But again, I think people need to focus on the fact that it's Delta that's causing almost all the illness that's going on. And as people gather for the holidays, as they're traveling more, the airlines are expecting pre-pandemic levels of travel for the holidays. People need to be careful. They need to mask up. They need to, keep doing the kind of precautions that have kept them safe all this time. And really think about who they're associating with, who they're with, because it is really everywhere already.
So would you be recommending, Dr. Grossman, just in our everyday lives, like if I am going to the grocery store, I've gotten personally very relaxed when it comes to wearing my mask, especially when I'm going shopping or whatever the case may be. So should we be wearing our masks again? And I'm triple vaccinated.
Yeah, Tony, I got pretty relaxed with that too when I was living in Florida. But since I've been in Chicago, where there is a mask mandate, I've been wearing it. And you know what? I think it makes sense. If you're in a grocery store, you really don't know the status of the people around you. And clearly we're seeing breakthrough infections. So I think that that's important. I've been to the movies a few times lately, and the movie theaters are basically empty. I mean, there's so few people in them. And truthfully, in many places, you need to have a vaccine card to get into a movie theater. If you're sitting in a room with 6 people in a huge theater who are all vaccinated, I think if you take your mask off at some point during the movie, it's probably not a big deal. But in a more crowded situation, or a situation where we don't know the status, yeah, I think the mask is definitely makes sense. And certainly, that's what we're seeing them doing in Europe, and much of Europe. Indoors, you wear a mask. Outdoors, it's not a big deal, especially if you're vaccinated. Unfortunately, most places in New York, you can't walk into a restaurant without a vaccine card. You can't go to a movie theater. You can't go to the theater on Broadway without being vaccinated. And pretty soon, it will require triple vaccination. So I think those are places where maybe people can relax a little bit, but the mask certainly does, offer more protection.
Thank you, Dr. Grossman.
For sure. Good evening, Dr. Grossman.
And we don't want people to freak out. I'm sorry, Lexi. We don't want people to freak out. I think it's just basic precautions, and, in most cases it'll be okay, but the more you can do it consistently, the safer you are.
Absolutely.
Good evening, Dr. Grossman. I hope you're staying warm up there in the cold north of Chicago. That's crazy.
It's going to be 65 degrees here tomorrow.
Ooh, it's a
Shorts
heat
weather.
wave.
Global warming.
Right. So we briefly touched on mental health issues when we're around our families during this time. And with this variant, what we really want to know is, after this 2-year delay in celebrating holidays the way that we used to, how do you feel about the variant? Is it now safe to be with our friends and family this holiday season, even with this new variant?
Well, truthfully, I think it depends on your vaccination status. And, I went home for Thanksgiving and to New Jersey, and we've had 40 people for Thanksgiving. Everybody was triple vaccinated. And we all took a COVID test before we went. My cousin insisted before we came, we do COVID tests. So everybody had done it, and we were fine. We didn't wear masks with each other. We were hugging and kissing and everything else. And truthfully, I think given those guidelines, we were very safe. I think in families where people have not been, I mean, I know a friend of mine here, for example, her daughter has some autoimmune diseases and has decided that she's not getting vaccinated. She's not being invited to the family Christmas in Atlanta. And, you know, that's okay with her. She's chosen to go this way. But so I think people really kind of need to make their decisions. But I think if you're in a mixed group of people, you have to be more careful.
I wanted to add on that, Dr. Grossman. This is Jeff Oliverio. Do you think the testing, which I find we don't talk enough about, that testing before an event or having family, I have a family member and we have a 2-year-old nephew in my family, so obviously he can't be vaccinated. Do you recommend people just going getting the over-the-counter, vaccine test or COVID test before they go into a setting where they're going to be around their friends and family, even if they've been vaccinated, because they can still be a carrier?
Well, Jeff, for years with HIV and with other things, we've talked about harm reduction. You can't eliminate harm completely, but you can reduce your risk. And all of these things help to reduce risk. So I think doing those tests the day of or the day before you actually are going to that party does add that extra layer of protection. I think people can always wear masks if they feel, less comfortable. The 2-year-old kind of depends on where the 2-year-old, if the 2-year-old's in preschool and exposed to a lot of people, that's a different story than if a 2-year-old is at home all the time with mom or dad and not being exposed to things. So you really kind of have to play that by ear. And again, this virus is going to be around a long time, and there will be other viruses. You can't eliminate your risk. Life is not a risk-free venture. You can only, wear a seatbelt, put on a bike helmet. Doesn't protect you from everything, but it sure helps.
Good advice. Thank you.
We are so lucky to have you, Dr. Grossman. Thank you for being with us week after week after week, answering our questions. That is
Well, I'm
this
lucky to have
evening's.
you.
Thank you. That is this evening's Queer News Tonight Q&A on LGBTQ plus health and pandemic. We are here every Tuesday, as I just said, with Dr. Howard Grossman to answer your questions. Dr. Grossman is joining us from the prestigious Howard Brown Medical Center in Chicago, the largest LGBTQ plus health resource in the Midwest. Thank you again, Dr. Grossman. We'll see you next week.
Have a great holiday.
You too.
LGBTQ plus news is vital for our community and for the broader world as a whole. We have enough enemies at Fox News. Tucker, Sean, and Laura are loud. We need passionate allies. Happening Out Television Network, Queer News Tonight, and It's Happening Out are literally out of the closet and into the headlines. Our community needs your support. Like this broadcast and subscribe now to ensure the growth of the entire